resources allocated to this. Love it here at Sprout. I would love to continue to work here, but one of the school districts just offered me $15,000 more than I'm earning. And there's nothing I can do about that except wish them good luck. And so as a result, another group of kids went on the wait list. So, so the people that want to work in our industry are there. There are enough of them in the market to service these children, but we just cannot pay them enough.
If you can wrap up your...
What's that?
That's your 3 minutes. If you want to make a final statement?
Oh, sure, absolutely. So the county gave us a bump in pay in 2023, a 10% increase. It was the first pay raise since we started in 2011. That pay raise has been wiped out because of inflation. So my statement to you today is I would welcome the opportunity for you to consider adjusting that rate. I'd be happy to provide more details and would love to be involved in that process.
Thank you very much.
Yep.
Our next speaker is Christopher Lucas. I think it says I believe the speaker on deck is Bethany or Aaron. They both look like a 5 and a 3.
Thank you, Chairman Romeo. I'm Dr. Chris Lucas, a professor of child and adolescent psychiatry and vice chair for pediatric hospital psychiatry at Upstate Medical University Hospital. There is a national crisis with respect to child and adolescent mental health. The system is broken, and as the only children's hospital in central New York, Upstate Golisano Children's Hospital is in the front line dealing with the consequences of this. There's been a steady increase in the number of pediatric patients presenting to our emergency department with mental health crises. A specific problem I wanted to highlight today is that of so-called social admissions. Children and teenagers abandoned by their guardians who feel unable to care for them any longer. 3 deficiencies in the system aggravate this systemic problem, one that is seen in Onondaga County, throughout New York, and indeed across the nation. Firstly, there is a shortage of high-quality outpatient psychiatric services, with parents often facing wait lists of up to a year. Secondly, there is a lack of intermediate level services that can divert children from inpatient units or provide step down following a psychiatric admission. Finally, and probably most importantly, there's a deficiency in the provision of residential beds, facilities in the state that can provide longer-term treatment for children with chronic mental illness and behavioral problems, and places that provide somewhere for children in the care of the county to live when their placement has failed. I believe that in 2009, there was a state and county funded unit established, the Family Support Center at Elmcrest, that provided acute and short-term housing for children whom the Office of Children's Services had difficulty placing. After losing their funding, this closed approximately 10 years ago, increasing the pressure on the hospital, who frequently is left to fill that gap. Upstate Golisano Children's Hospital is the place of last resort when the system has failed children. We cannot and do not turn anyone away. If families could access appropriate outpatient care, they would not need to come to the emergency department when their children are in crisis, or indeed that emergency could have been prevented. If partial hospitalization and day treatment programs were available, children and teens could avoid inpatient psychiatric care or speed their discharge from such units, increasing throughput and reducing boarding of kids in the emergency department. In 2025, there were over 60 children abandoned in our hospital because no appropriate place could be found.
Dr. Lucas,
Some stayed over a year.
go ahead.
Children in the custody of Child and Family Services stayed much longer, an average of 49 days, which both blocked available medical beds and increased the sense of abandonment these children felt, often leading to aggression versus hospital staff. I realize many of these problems require federal and state solutions, but refunding and reopening the Family Support Center is the one thing that the Onondaga County could do with appropriate budgetary action from the legislature. Thank you for your attention to this matter, and I welcome setting up further meetings and invite you to visit us at the Children's Hospital to discuss these issues in further detail. Thank you.
Thank you, Dr. Lucas. Aaron, I can't. Aaron G, it looks like. Do you have a card with the 3 on it? Who has a card with a 3? No. Okay, it looks like then we skip somebody in between. Who has a card with a 2 on it? Okay, come on up. I'm sorry. I apologize. I don't have your name down as number 2. If you can state your name. Yep.
Good afternoon. I'm Amy Ells. I'm the Chief Innovation Officer with Access CNY, a local nonprofit agency supporting people of all abilities, children and adults. I appreciate the opportunity to come speak today about 2 different collaborations that we're working on with the county. The first is the Systems of Care. Access CNY Systems of Care Initiative is a collaborative partnership with Onondaga County and community providers to better support children, youth, and families with complex needs. It focuses on improving how services work together so families can more easily access the help that they need. We help families navigate multiple systems, including mental health, developmental disabilities, education, and child welfare. We coordinate care across providers, schools, and county partners, and elevate family and youth voice to shape services and fill gaps in the system. This program started a few months ago, and we are currently serving over 36 children and families. Another key component of this program is that we provide START-informed supports, which is a crisis prevention and intensive coordination program. We provide specialized intensive coordination for youth with both developmental disabilities and mental health needs. We focus on preventing crisis, reducing hospitalizations, and stabilizing children in their homes and communities. This is a nationally recognized model that helps us better understand complex behavioral challenges. We've had great success with this program and are actually in the process of adding 3 additional family peer advocates. So these staff are working very closely with families to help provide support to them in these very, very challenging times. We offer a couple times a week opportunities during the day and in the evenings to connect directly with families. We are also looking to add a staff to provide psychosocial rehab, which is a program that has not historically done great in the county, and so we're hoping to bring this service back and get some children served. The second program that we're collaborating with Onondaga County on is supervised visitation, supporting families in foster care. We work with the county to support safe, structured visits between children and their parents, providing coaching, modeling, and real-time feedback to strengthen parenting skills. We use a trauma-informed supportive approach to help families progress toward reunification and we aim to improve the quality of visits and reduce the time children spend in foster care. This program is very newly opened for us. We are one of a few providers in the county providing it. We are currently at 14 families in just over 2 months and receiving really wonderful feedback from both families and county caseworkers on this program. It's staffed by a licensed mental health social worker, and we currently have one coach and looking to expand this program.
If you can make your final comments, and anyone that isn't able to finish their comments can submit their comments to the Onondaga County Legislature email.
So just to wrap up real quick, we really feel like we're helping to strengthen family stability and support reunification when appropriate in the area, reducing fragmentation across systems and building stronger collaboration between providers, schools, and county partners while ensuring youth with complex needs receive the right support at the right time. Thank you.
Thank you, Amy. Since the numbers on my sheet clearly are not in line, who has a card with a 4 on it? If you could step up to the podium, please, and state your name. Ruthie, are you collecting these? Okay.
Good afternoon. My name is Amelia DeRusha. I have worked in therapeutic foster care as well as in the residential setting. It's true that the issues that plague the county services are cannot be argued, as there are many. It is true that more foster homes and therapeutic foster homes and residential treatment facilities are in desperate need for these young individuals in the care of the county. Each of the individuals that is in the care of the county is a future adult contributing to society as a whole, like any one of us here today. A concern that needs to be understood is that many of these young individuals do not receive adequate care by case managers due to the lack of communication and not following the recommendations of providers for a change in the level of care. Issues such as these can cause any one of these young individuals to become institutionalized, to such an extent that they do not have the skill set to survive normally in society. I have seen individuals languish in care for years because they have been in the residential setting for so long. They don't know how to live normally and want to grow up in a family setting. Some of these individuals eventually are so lacking in skills that they require a detention center level of care. I know several individuals eventually are lacking in the skills that they repeated myself. So I know other individuals that have been placed in the residential setting due to the lack of foster homes, and now, several years later, are being bounced around from one residential placement to another, separated from siblings. Some of these individuals are no longer in the care of the county for the original reason that they went into care. When things such as this occur, eventually there are adult consequences. But due to the lack of appropriate care and social skills, young individuals don't care anymore. They just want out. They want to be part of a family somewhere where they can belong. This is such a disservice to these individuals and families and to our society as a whole. Please help us put a stop to such issues as these. Caseworkers need to have lower caseloads so they can improve the level of communication with families and providers to do their jobs, not just adequately, but significantly better. Equally important is the case managers need to follow recommendations of providers so the individual.
Will the speaker with card 5 please approach? If you could state your name, please.
Yes. Hi, everyone. My name is Bethany Creaser, and I am the Executive Director for the Early Childhood Alliance Onondaga. I always like to say, though, my first and most important job in the world is that of being a mom of four. So anyone who can relate can understand that I say it's the hardest job in the world. And unfortunately, right now, parents are struggling more than ever. I am here really to start by thanking the county for their investment and understanding of the importance of investing early. The rate of return on investment in the early childhood years is incredibly important, and the Early Childhood Alliance would not exist without the funding and support from the county. So I want to start by saying that. I know the goal is to come together to figure out how the county services can address the needs of children and teens. And I believe it starts by working together as a community to identify the gaps and needs and include the parents in being a part of the solution and identifying the solutions that work. In working with the Department of Children and Family Services, we align in understanding that when we offer the right resources, support, and services to families so they have access to the things they need to give their child the best start possible, that is how we are going to decrease the number of children who are in our foster care system. The best intervention period, in my opinion, happens before the baby's born. The programs the county invests in are Help Me Grow Onondaga, where parents can call on their own 211 hotline. I need help. I don't know what to do. I need diapers. I need formula. Not only are they linked and connected to services, they are also given support on how to understand how to support their child's development. If parents have what they need to give their children the best start possible, A, we're going to decrease the number of kids in the foster care system, and B, we're going to help prepare those children to be ready to enter kindergarten, ready to learn, and ready to be successful adults in our community. We bring together all sectors who work in the early childhood system. If you are and I know that Ann Napper, the executive director from Child Care Solutions, is going to talk about the county's investment in strengthening our child care and early learning infrastructure, and we're grateful for that as well. We've got child care and early learning. We have our home visiting partners, our early intervention special children's services partners. I know I'm forgetting pediatric partners. Anyone who touches the early childhood system comes together with the Early Childhood Alliance to come up with solutions, and we could not do that without the support from the county. We don't have all the answers, but we need to identify who's the expert in each area and figure out how we work together to support the parents in supporting their kids. So we are a unified, strong early childhood system. Thank you.
Thank you. Perfect timing. Perfect timing. We have number 6 ready to go. When you get to the podium, please state your name.
Good afternoon. My name is Ann Napper, and I am the Executive Director of Child Care Solutions here in Onondaga County. And I'm here to speak to you on behalf of the county and some of the support they provide us in the community. Onondaga County has been a strong and valued partner in supporting early child care initiatives across our community. We know that Onondaga County works through the CCAP, the Child Care Assistance Program. The county helps working families, students, and those facing temporary hardships access affordable, reliable child care so parents can remain in the workforce and children can thrive in nurturing environments. Onondaga County, childcare in Onondaga County, childcare remains one of the greatest challenges for families and providers. Rising costs, staffing shortages, and limited access continue to strain the system. In 2025, due to limited funding, new CCAP applications were placed on a wait list, highlighting the urgent need for sustained investment. The county recognized that this hardship was going to change the way we create a pathway for working families, especially for those that rely on the CCAP funding. As a result, the county took proactive steps by applying for a waiver that would allow us to continue serving 95% of current families that were on the CCAP program. In 2024, the county allocated funding to early childhood providers to provide them with capital improvements to their programs so that they would remain in compliance with New York State regulations. In addition to the funding through those supports, the county also recognized that the number one thing that families said is the greatest need for them is to have quality child care for their children. So the county also supports a child care quality improvement program through Child Care Solutions and the Early Child Care Alliance. As Bethany mentioned earlier, one way for us to look and identify those gaps is to work together and come together as a community, and with the county's support, we will be to continue to do that. Thank you.
Thank you. Thank you. Number 7. I have a note here that we skipped Aaron Grassini. No? Okay. Got it. Next up, if you could say your name, please.
Good afternoon. My name is Bryn Lovejoy-Grinnell. I'm an attorney for children. I've been an attorney for children for 9 years in Onondaga County. And I want to start by saying that my job and livelihood do not depend on a contract with the county, and I have not been asked to speak here by any entity. I am here because I care about children, because I represent them, because my job is to represent children as well as their best interests. And I want to start by saying that holding this hearing demonstrates incredible courage from the county legislature, and particularly the Committee on Health and Human Services, the courage to hear the really difficult truths, to hear perspectives from different people whose lives touch children, whose work touches children in some way, takes a huge amount of courage. And I really thank you and applaud you for doing that, because this kind of transparency has not occurred in other years, and I appreciate that. I want to start by being a nerdy lawyer and say Social Services Law, Section 409A mandates that the Department of Children and Family Services provide preventative services to children and families to avoid foster care placement. The department is required to make reasonable efforts before a child may be placed in foster care. My experience in the last 9 years is that preventative services in Onondaga County have deteriorated or been eliminated, particularly in the last several years, which was resulting in many more children being in foster care than should be in foster care. And if you look statewide, we have the highest foster care, some of the highest foster care rates across the state. Families used to be routinely assigned parent aides, as just one example, to support families and reduce the need for foster care. Parent aides in cases that I represented children in would help parents learn how to clean their homes, to, instruct parents on discipline, help them with finding housing, the basic skills of parenting that many people take for granted, but that many children who are experiencing some kind of abuse and neglect are not experiencing in their household. Education about child development, and direct support in accessing resources. Parent aides often spent hours per week in homes with families, and I see rarely, I can't name a case that I have where a family has been assigned a parent aide to do those kinds of things. Parents are routinely handed a list of housing, of the open available housing in the county, and say, go call for housing. I'm not sure if families are being made aware that Section 409 of the Social Services Law says that families can be given up to $725 a month for up to 3 years. That's authorized by the statute to help them find housing. When we have so many children being put in foster care because their families don't have sanitary, safe, and stable housing, and we have this resource available to them, that's a disgrace. That's a disgrace to our children. I hear
Bryn,
you.
if you-
Thank you. When families receive robust preventative services mandated by law, conditions in homes, when families do not receive those services, conditions deteriorate in homes and children become less safe. And then the county files neglect petitions and removes children to foster care. There is demonstrable, provable harm to children and families when children are removed into foster care, causing generational trauma. And I appreciate this opportunity, and I sincerely look forward to the efforts that I know you all will make to improve these conditions. Thank you.
Thank you. And if you had more remarks, you can submit them to the legislature. Good afternoon.
Good afternoon. My name is Annette Scott, and I'm an attorney for children here in Onondaga County, focusing primarily on children who are abused and neglected here in family court. I'm also here on my own accord. I don't have an employer or a funder requiring me to be here. I would like to see more foster homes, including therapeutic foster homes, and more local residential facilities for our youth who are in care. Children who are removed from their families by DCFS often require a higher level of care, many having endured trauma before being removed, and many in distress from being removed from their homes and families. These children usually require therapeutic care, and the department is provided significant resources, including an enormous budget, to be able to adequately address these very needs. Our children should be able to get the treatment they need from within their very own community. Instead, foster children are often sent hours away to live in institutions far from their families. And so in addition to being removed from their families, from their home, they lose their school community, they lose access to their extended family, and all of their friends. For some reason, I have cotton mouth, apologize. For some reason, we also have a shortage of foster homes within this community. So now, even children who are not deemed to require this higher level of care are being farmed out to foster homes well outside of this community. And because of that very same shortage of foster homes, once our children have been sent to these facilities, have completed their recommended treatment at these institutions, which is the very reason they were sent there in the first place, they're still left to sit there for months or even years. And DCFS allows that to happen despite knowing the harm of allowing children to languish in these institutions. Equally as pressing is our need for more caseworkers and more experienced and better trained caseworkers. Caseworkers are frontline workers tasked with ensuring the safety and well-being of the children in this community. They need low enough caseloads for them to spend an adequate amount of time on each case so that they can thoroughly investigate concerns and so that they can provide meaningful help and resources to struggling families. A lower caseload would also help to provide a work environment that is more conducive to retaining caseworkers. When caseworkers are overloaded, important details go unnoticed. And as this community is well aware, this can and will lead to serious harm and even death of our children. And I honestly do not believe that any of the conditions at DCFS that led to tragic deaths of the children in this community have truly been ameliorated. Thank you for your time.
Thank you, Annette. Number 9. Robin? Perfect. It looks like my numbers lined up finally.
afternoon. My name is Robin Zimpel. I'm an attorney here in Syracuse. And for the past several years, I have been representing parents in family court matters here in Onondaga County. I am not being paid by any agency or anyone else to appear here. It is solely because of my conscience that I appear here to speak with you. I represent the father of Amora Graves, a 4-year-old girl who died during the pendency of a CPS investigation. On June 30th of 2025, a report was called in with regard to this child's mother leaving her 4 very young children in the care of a babysitter for very long extended periods of time without leaving any way of contact, without leaving adequate resources. DCFS did go out and saw the home of this babysitter, noted in the report that it smelled of garbage, the paint was peeling, the walls were dingy. There were filthy conditions, it was very dark. There was a room that they were not allowed access to. There were people there that would not provide their names to the investigators or the caseworkers, and those that would not cooperate. When they spoke with the mother, now this was not the mother's house, this was the babysitter's house. When they spoke with the mother the next day, she denied the allegations and then was caught in a lie. Another report was called in with regard to the same mother on July 14th of 2025, allegations of the mother leaving the children with inappropriate care providers, excessive alcohol use, domestic violence in front of the children. DCFS followed up. Now, from the notes that I have from DCFS, at no point in time did they say, do not leave your children with that babysitter. She is inappropriate. At no point in time did they offer her services, either a parent aid, which have gone the way of the dinosaur around here apparently, or respite foster care, which also is sparse, if available at all. That investigation remained open until August 28th, 2025, one day after Amora Graves was found dead from a methadone overdose in that babysitter's house.
Robin, can I just ask that you keep names of children confidential, please?
It's
I understand. We're
publications.
just, it's the case specific.
This child should not have been there. This mother should have been provided services. I have other parents who have their children out of their homes for extended periods of time because they do not have safe, stable housing. There is a housing crisis here, and the children are being kept in foster care. And there's not enough foster care here in Onondaga County. I have a family who has their children in foster care for the past 2 years on the far side of Rochester. They have no transportation. They get to see these children once, 2 hours, every 2 weeks, and that's been the case for 2 years. They can't increase the number of visitations. They can't increase the length of the visitations because the resources that are required to transport these children to have visitation with their families. I have parents who are not getting their children returned to them because they lack safe, stable housing, and that's the only reason. I have children.
If you make your final statements.
Yes, I have children, families who are not getting their children back because these services that are being offered to them are not tailored for their needs. They have disabilities, and they can't take advantage of these services because they're not tailored for them to be able to have those services actually help them. I don't know the solution here, but there's got to be something, and I have not seen improvement since the death of that child. Thank you.
Thank you. Charisma? If I said that wrong, please repeat it in the mic.
Good day. My name is Charisma Dezzoni, and I represent Oneonta Job Corps Academy, a federally funded workforce development program under the U.S. Department of Labor. I'm here on my own accord because I believe community at large needs to know that Job Corps is a powerful resource available to young people right here in Onondaga County. Job Corps serves eligible young people between the ages of 16 to 24 who may need a different pathway to education, training, employment, and long-term stability. For many young adults, barriers such as housing, instability, lack of transportation, unfinished education, unemployment, limited family support, or simply knowing what comes next can make it difficult to move forward. That's where Job Corps can help. Job Corps provides a full support system at no cost to eligible students. Students can earn their high school diploma or equivalency, receive hands-on career technical training, gain industry-recognized credentials, and build employability, leadership, and independent living skills. Our center offers free room and board, meals, basic health services, and supportive services. This allows students to step into a structured environment where they can focus on learning, growing, and preparing for real careers. Oneonta Job Corps serves in areas such as healthcare, construction, security, office administration, culinary, and other high-demand fields. And because Job Corps is a national program, eligible students can also be connected to training opportunities at more than 100 centers nationwide, allowing placement to align with their goals, trade interest, and program availability. For Onondaga County, Job Corps is more than a youth program, it's a workforce pipeline, a prevention resource, a second chance opportunity. It's a resource for families, schools, workforce agencies, community organizations, courts, shelters, and anyone working with young people who need a positive step. Simply put, Job Corps helps young people turn uncertainty into opportunity by giving them access to free education, career training, housing, meals, health services, mentoring, and job placement assistance, all designed to help them become employable, independent, and successful. My goal is to make sure this opportunity is no longer one of the best-kept secrets in our community. Thank you.
Thank you. Our next speaker is Bruno Pramarano. Hi, Bruno.
Good afternoon. Sorry, I'm not as prepared as everybody else, so I won't be as lengthy. My name is Bruno Pramarano, and I work in the Syracuse City School District within the Student Support Services Department. Thank you for the opportunity to speak today. The Syracuse City School District attempts to grow services and partnerships across the city and county that help all our kids and our families. Collectively, all the services represented in this room, from birth to adulthood, can truly make the difference needed to transform lives. As a building principal and district administrator, I've personally experienced families asking me for services beyond the scope of what the school district provides. They do that because of the relationship that they have built with me. They trust us to help them. Every year, our multi-tiered systems of supports that we offer grow, and we leverage all of our partnerships within the city and the county to give our families all the possible supports that they need to help their children succeed. Again, we appreciate these partnerships and collaborations we have across these agencies. In addition to what everyone else has already spoken about this afternoon, especially Dr. Lucas from upstate, one barrier we would like to overcome for our kids is transportation to and from physical and mental health services. Transportation should never be a barrier for our kids and our families. We would love to expand our partnership with all of our mental health service providers and with our physical school-based health center that we have in our schools. If we can't do that, we would like the opportunity to bring those services to our kids. In addition, we need help transporting students and kids between schools and to the services they need. Vans, drivers, attendants, providers, that's what we're looking to do. Expand until we can fully collaborate together and get our parents and our families and our kids all the services they need at home. Thank you.
Thank you, Bruno. Our next speaker is Rashida Caldwell.
Good afternoon, blessings to everyone here. I'm here on multiple positions. So first, I would like to introduce myself. My name is Rashida Caldwell. I'm a common counsel at large for the city of Syracuse. I also work for Allen Foundation. I'm the director of youth and community engagement. I have a organization called Let Me Be Great. And I just love the kids, right? I'm a kid in heart, right? So I'm sad to hear about some of the stories, and my prayers are with some of the families. But I just want to give a shout out to some of the great experiences I have had at the county with supports and making phone calls and operational. About 2017, 18, there was a idea to come up with a workforce job opportunity for kids. And the county was one of the first people that stepped in and said, yes, that's where we recreated Dunk Your Junk. Let Me Be Great, Dunk Your Junk. And kids had the opportunity from 10 to like 18 to get a work study and be a part of it, right? And it was a great, which has now started off to this whole nother operation where we have a fellows program where our youth are now having an opportunity to work and learn about financial literacy and education and having chances to learn about job careers and mental health, which has expanded. I've also been able to learn that the county has supported some operations of community engagement with kids being in activities and sports. If you don't know me, I'm big on sports, right? I believe if you play a sport or activity, that you're most likely to be more successful in life, and you'll be able to deal with life, right? You'll be able to deal with conflict. You'll be able to deal with wins and loss. You'll be able to deal with team efforts. And the county under Youth Bureau has been phenomenal with changing the narrative to helping support that. So I'm going to say I am thankful for that. What I will say is, as a community, it is hard, right? We are going through so much. And it's not a one-person thing. It's not one person's fault for anything going on. Do we need more services? Absolutely. Do we need to do more collaboration? Absolutely. Do we need to make more opportunities for our youth? Absolutely. But I'm very thankful for the opportunity that the county does. On the flip side, for the Allen Foundation, they help support for the youth for the summer, the Fellows Program, which will allow county kids to be a part of the Fellows Program. So I'm thankful for that. But I would like to say, we can do more, we can get more. And I don't believe it's a one person's issue. As a common counselor, I talk about it all the time.
Is there anyone else that wishes to speak? Okay, if you could come up, please. Ruthnie, do we have a card she can fill out? Oh, okay, I'm sorry. That's why Erin had her number next to her.
That was me.
Okay, what's your name?
Jessica Hops.
Okay. You can begin when you're ready.
Good afternoon. I'm Jessica Hops. I'm the program manager over at CCSI. I've been there for 10 years. but I've had the privilege of working in this county for over 20 years. And during that time have established a strong partnership with the county through many programs that are run through CCSI. I'd like to talk briefly about some of the programs and at the end share some of my lived experience and how it really contributes to some of the work that we do. So CCSI partners with Onondaga County through the Access program. Access is designed to support youth ages 0 to 21 who are struggling with their mental health. This program has evolved over the last 15 years to a place where we have school liaisons who are in 119 buildings in Onondaga County. And what they're there to do is to really meet with the social work team, hear about kids that are really starting to struggle, not only with their mental health, but with attendance, families that are struggling with housing, and provide outreach. One thing that is very unique about this program is that it not only has staff that we hire that have a great background in case management, but we really emphasize staff that have lived experience. Having a team member who has had a child who has struggled with connection to mental health services, or a team member who has had a child who maybe has been through the Juvenile Justice Center, provides that experience and that ability to connect with families in such a different way. That program, as of today, has had 2,700 referrals come through. And what I will say is that program has over a 90% of engagement with families. So these are referrals we receive from the school, and through training around engagement are able to connect with families and really do a deep dive into their needs and help connect them to the many services in Onondaga County. Another service I would like to talk about is Healthy Transitions. And this is one that is dear to my heart because I have a 17-year-old that struggles significantly with her mental health. And being able to partner with Onondaga County and have a program in our community that supports youth ages 16 to 25 with significant mental health transition into adulthood. We all know how hard it is going into adulthood, navigating your first job, navigating all those processes that you need to do. Having a case manager to support this youth is so important in Onondaga County. And that is staff who also are peer certified, which means that they have had their own mental health needs and can provide that lived experience and experiences to the youth. So I would like to thank Onondaga County for your continued support, and I look forward to our continued work together.
Thank you.
Thank you.
Is there anyone else that wishes to speak? Okay. Not seeing any more speakers. I would like a motion to adjourn this portion of the public hearing until 6 p.m. tomorrow, May 14th, at Salt City Market Community Room, located at 484 South Salina Street. Motion by Legislator Denton. Second by Legislator Black. All in favor? All right. Any opposed? All right. Motion passes to adjourn until tomorrow's public hearing. Thank you all for coming. Appreciate your